Good afternoon, everyone. As we have everyone joining, we're going to wait just a minute so folks can get logged in, and then we will get started. All right, looks like we've got a good number trickled in, so let's go ahead and get started. Good afternoon. Thank you so much for joining us for an informational webinar for the Center for Dementia Respite Innovation, CDRI as we like to call it, and this is for our grant program. We're so thrilled to be offering this opportunity. So my name is Isabella Marini. I am the Associate Director for the Center for Dementia Respite Innovation, and I oversee the day-to-day management of the center. The purpose of this webinar is to help applicants understand the key goals of this project, the grant requirements, the criteria, the required measurements and outcomes, the application structure and procedures, overviews of budgeting and the required in-kind contributions, and then we will also leave time for a Q&A portion at the end. We're going to kick off with some introductions to the CDRI team, and then we're going to move into a high-level review of the requests for applications, the RFA. Next, we will review the budget template and the submittable application platform. And again, we will allow for that Q&A discussion at the end. Please submit any questions that you might have throughout this webinar using the Q&A function on the Zoom platform. We're going to monitor submissions and address accordingly. All of the questions that will be asked will be added to our frequently asked questions document, which is linked on the center's webpage. As a reminder, this webinar is being recorded and it is going to be posted on the center's webpage in the few days following. So now I would like to formally introduce you to the CDRI team. The center is led from the Alzheimer's Association with partners at the University of Minnesota and at US Aging. First, I would like to introduce Dr. Sam Fazio, who is the principal investigator on this program. Sam?
Thanks, Isabella. Hello, everyone. I'd say great to see you, but I can't see you all. So it's great to have so many people on the call. I'm really excited to be part of this project. Just to give you a little background, I started my work in dementia care in 1987 when I helped open the first dementia-specific daycare center in Illinois. And it's really exciting to come back, 36 years later and be part of a big initiative to impact respite care around the country. I always felt that I learned about what person-centered care was during my time at that day center and have brought that with me to all the work that I've been doing at the Alzheimer's Association national headquarters for the past 30 years. So thank you for being here. We're so happy to be part of this grant and work with US Aging and University of Minnesota. And I look forward to talking through the RFA with you.
Thank you. Next, I will turn it over to our partner at US Aging, Sarah.
Thanks, Isabella, and good day, everyone. I don't know what time zones everyone's in, so good day seems to work pretty well. So I'm Sarah Maloney, and I'm a program director at US Aging, and we are very pleased and happy to be serving as a partner on this grant for the CDRI. And I am also very excited to be a part of this grant because I also, like Dr. Fazio, have a personal tie to my start working with people with dementia and also caregivers, working in adult day programs, long-term care communities, and just very excited to see the innovation that this spurs, and very excited to work with all of the partners that are involved. So thank you, Isabella.
Thank you, Sarah. Our next partner is Dr. Joseph Gogler, who works with the University of Minnesota. Unfortunately, he had a conflict, so he will be joining us a little bit later, but just a little bit about him. He is the professor and director for the Center for Healthy Aging and Innovation at the School of Public Health at the University of Minnesota. He will be helping our efforts in reporting and evaluation of the center, along with just general oversight of the program. In addition to our CDRI leaders, I want to highlight a few additional support staff members from the Alzheimer's Association that are on the call. First, Dr. Lauren Stratton, the Senior Associate Director of Psychosocial Research and Program Evaluation. She played a very large role in crafting our initial submission for this award and will be supporting the center in various capacities, but more focused on evaluation and the education modules that we create. In addition, we have Lorna Profiter, our Director of Psychosocial Research and Fund Management at the Alzheimer's Association. She will be assisting on just general strategy and helping with oversight of the center as well, and she is going to be helping us in our Q&A discussion and facilitating those responses. And then last but not least, we've got more blessing Zifa Akwi. She is the Senior Director of Sponsored Programs and Government Grants. She is what I like to call our budget guru and will support in all things budget as needed. Now I'm going to go ahead and pass it over to Dr. Fazio to review the RFA as I share that on the screen.
Thanks, Isabella. So we're going to do a really high-level review of the RFA and just sort of give you an overview of each section. And if you have questions, we're going to save questions till the end. So please make yourself a note and we can answer any of your questions. Just remember that we're going to go over the RFA, the application process, the budget, all of that. Unfortunately, we cannot give you input on your idea or your proposed project. We could just give you information about the process, how to apply, and the RFA. So, okay, we can move forward to the next page. You can see we start out with a table of contents to help you find your way. But let's go to the first part, which is the grant overview. So this is just a sort of a little overview box for you to see everything we're looking at. Purpose, eligibility, the release date. And so let me just go over those dates with you really quickly. Some of these other things above we'll be talking about, and this is important to keep in mind. So we released the RFA on March 1st. We have this webinar today that will be posted on our webpage. We then ask that if you can, send a letter of intent to us. And that could be very simple by March 21st. This will give us a gauge of how many reviewers we're going to need. The application due date is on June 1st. And Isabella will go over that application site with you. It's very easy to use. And you just fill in the boxes. I think you'll find it really user-friendly. And then, believe it or not, we're going to get award notifications out really quickly, July 1st, so that projects could start right on August 1st and go for the year to July 30th. As you can see, we have a maximum of about 20 grants per year that'll be awarded. We have a total of $4 million a year to give out, which is very exciting. So that's $20 million over 5 years that will be granted out to communities to become more dementia capable. We have 2 different types of awards this year. We have startup awards that are anywhere from 50 to 149, and you're going to decide where you fall into that range based on what you propose. And then we have pilot awards that are a little bit more higher, 150 to 250. So those might be more appropriate for established programs, whereas the startup awards might be more appropriate for somebody who's just starting out in the field. And then starting next year, we'll have continuation awards where you could reapply to either expand your service or add a new dimension. So let's go into the meat of this all. So I'm going to skip through the background, but I think you are probably all on here because you're involved in respite or know the importance of respite, right? So it's one of the biggest requests that we hear from our families that they need a break, but a lot of times they don't know how to find that break or even how important that break is. So the whole goal of this initiative is to really find ways that we can make services available, accessible, affordable for people living with dementia and their families so that they could be better caregivers for a longer time. So can we go on to the next slide and let's talk a little bit about the leads. We basically mentioned this in our introductions, but this is a partnership with the Alzheimer's Association as the lead, along with US Aging and the University of Minnesota. So I'm not going to go over these definitions, but I just want you to make sure that you pay attention to them when you look through the RFA. What is respite care? And then what is innovation? Because that's something that we're really looking for. We're really looking at innovative new ways to meet people and provide respite for them. We see other terms here like dementia, dementia capable, person-centered care, and underrepresented and underserved unmet needs. So that's also important, right? Not only how can we be innovative, but how can we be innovative in a way to reach people who we don't typically reach? Okay, we'll go down to the next section, which is the request for proposals. So as I mentioned, each year we'll be funding an estimated 20 grants that total up to $4 million. So that all depends on how many people apply in either pilot grants or in the other grants. Like I mentioned, we're looking for things that are based on innovation. And this is really a ground up approach. So we really want you to decide what it is you're going to do. And so we're not telling you what you have to do, but we're really saying, come up with your own, personal improvement plan for your organization for what are you going to do to make respite either available or existing respite more dementia capable. And that could be as simple as extending hours to accommodate working caregivers. It could be adding an evidence-based program and hiring a music therapist. It could be offering respite along with church services. Whatever you think, we want you to be creative and innovative. So if we go down a little bit more, and so you can see that applicants will have to talk through a budget template, and we'll talk through more about that, where you need to fill that out, and Isabella will talk through more about that, along with the match, because I know that you all have some questions about the match, and we'll try to make that as muddy clear as we can for you. And then let's go down to eligibility. So again, I don't want to read through all these requirements, but we're really pretty flexible in our eligibility here because we want to make it open to as many folks as possible and to folks who may not have been providing respite in the past. The biggest thing under there is probably those matching resources, and again, we'll explain that a little bit later. We do have a little bit of a restriction for funding to for-profit organizations. So unfortunately, no more than 30% of our funding will go to for-profit organizations. And just to keep in mind too, we'll also need to look at organizations with multiple sites, right? So there is some restrictions around multiple sites applying and being awarded. So you want to make sure you might talk to some of your other folks within your organizations so that you're not competing against yourself. One of the keys to the application is identifying one person who acts as the point person, the key professional staff person who becomes sort of the conduit to all of this and makes sure it's in part of all the learning and collaboration. So if we look at funding awards, I did mention this earlier, but there's 2 awards this year, is the Startup Awards and the Pilot Awards. So now down to allowable expenses. Again, I'm not going to go through all of this. If you have specific questions, you could go ahead and put those in the chat box. We could also reply to your specific situation separately by sending a note to the mailbox, and Isabella will answer you. But you can see some of the expenses: personnel, administration, outreach and engagement, technology, transportation, program materials and supplies. Can you scroll down, Isabella? Community engagement events, marketing, communications. So then the other pieces will be this funding limitations. And excuse me a minute, because it's always the right time when you're on a call and your dogs start barking, right? So let's let them bark from a door being closed in the hallway, and give me 1 minute. There we go. So no direct funding can go to any Alzheimer's Association chapters. And also you can't use funds for research beyond the scope that we're already doing in the evaluation. New construction isn't allowed. And you can see some of those other things down there. We Hope that nobody is double dipping with another grant that you might have. So we put that down as a restriction, as well as some other things like here of going to other conferences or professional development, things like that. These are really specifically related to making respite dementia capable for families and individuals in your community. So the match. So Isabella, do you want to talk about all the match now, or did you want to wait and talk about the match later? Because I'll need you to help with this.
Yep, I think we'll hit that when we hit the budget.
Okay, so we'll hold off on match till a little bit later, but know that we'll talk through this with you so that we can answer any of your questions. I know that calculation seems a little odd, but that's what comes to us from ACL to use. So we'll talk about that a little bit later. Okay, expectations. Of course, there's some expectations. We're not just giving you a bunch of money and you don't have to do anything, right? So there's some things here that we need you to be part of. So we after you're funded, there's a few different things: marketing and outreach, community listening sessions, ongoing technical assistance, and dementia support. So hopefully you'll see these as all opportunities. Scroll up just a little bit more. Yeah. So a couple things. It's really exciting that we have marketing support built into this. So our marketing staff will help awardees market their services locally. So that's a really cool piece of this, is that we'll work with the 20 awardees to market your service, get the word out. We'll also get the word out to people about the importance of respite. So our chapters in those areas will build some slides into all of their community presentations that talk about the importance of respite and what's available in the community. We'll also do this great community listening session where we're going to partner with US Aging or the local AAA, where in our local chapter, and the awardees. And we'll have a listening session very early on in the process after you get awarded to bring people together in the community to hear about what you're proposing and get some feedback on it. So we could really make sure that we're meeting the community needs. You'll also have ongoing technical assistance. So there's 2 TAs that will be working with 10 sites each. And so you'll have an ongoing TA person who helps you build an individual plan for your project and supports you along the way. We also then have several education and training and support opportunities. So everybody will need to take an educational module, a training module called the Fundamentals of Person-Centered Dementia Care and Respite that will be developed as an online course for folks to take. You also have these opportunities to be on monthly calls, and we would expect that all awardees would be on these calls. And so every other month, we have a webinar where somebody will really be talking about the business side of things and sustainability. So to help you with making whatever it is you're proposing more sustainable. And then on the opposite months, we'll have something like Project Echo or peer-to-peer learning, where we come together and talk about different case studies and work through it together of different possibilities. So one's more focused on the business side of things, and one's more focused on the care or programmatic side of things. But there's an opportunity each month to get together. And then once a year, we'll bring everybody together in a conference to learn more from each other and more about sustainability and programming. Here's a bit of the timeline that you can see of everything that's going on with the technical assistance, the listening session and all of that starting early, the training module starting early, the conference sort of midway through, technical assistance ongoing, and then you see the alternate months between the learning collaborative, peer-to-peer learning, and webinar. So the next piece here is the reporting requirements. Lauren, are you comfortable talking through these?
Sure, I can, Sam. Thanks.
Sure.
So we do have a few things that will be required within your participation for reporting. Of course, we want to be looking at this and seeing the full impact of the program that you're putting forth and just who you are serving, things like that. So we will be helping and facilitating all of these pieces, but there are a few aspects we are requiring. First is an awardee progress survey. This will happen 3 times throughout the duration of your award, at the start, at a 6-month mark, and then at the end. This is really just giving us basic demographic information about your organization, who you serve, and then just a review of how your, kind of like a progress review of how your program is going that you have applied to do. We'll also be looking to facilitate client staff surveys. Again, we really want to get the impact of the program that you are facilitating. So that will be at the start and the end of the award. That will just happen twice. And with that one, again, we're really looking to see within the caregivers that you're serving, is there an impact on their quality of life, burden, things like that, as well as with your staff, are they increasing self-efficacy, items like that. So we will for sure help facilitate those, but we will rely on you to help spread those surveys out to your client and staff. We'll also have an annual financial report that's due 60 days after your 12-month award period. There will be an end of the program interview. Some of us within the evaluation side will just be setting up a short call, 30-minute call, to talk through how you felt like the year went, what was achieved, items like that, and overall sustainability of the project. We will also have a post-award follow-up, which will be due annually each spring. So this continues on even after your year of the grant has ended. We will continue to follow up and see what progress has been made there. And then there might be a couple other forms that pop up, but again, we will be sure to provide how to document those things and make that as easy as possible. I think that's it, Sam.
Great, thank you. So I don't think we have to talk about the compliance piece. You guys could read through that, just to some of the eligibility there and being compliant as you submit. Keep going. I talked about this a little bit before, but you know, just to remind folks, these are the dates again. Again, if you could send a optional letter of intent, that would be great. It'll gauge us again how many reviewers we need. Okay, so we're going to talk through all of this in a little while with the application process. You could see there the letter of intent and some of the things to include. This will just give us an idea of your project and who you are, very, very high level. So don't, you know, don't fret about it. It's really, again, just so we get a gauge of what you're planning on doing, and so that we have enough reviewers in place. We'll talk through the whole site when we talk through submittable, so I'm going to skip through that. You could keep going. So let me tell you a little bit about how we review things. So we have a 3-tier process. We review a lot of grants. As you might know, our association gives out research funding every year to a lot of researchers, and we also do different bold public health grants. And so we have a lot of different systems. We found that Submittable was the best system to use for this because it was really user-friendly. So I hope you will also believe that. You could also, again, send messages to Isabella through the CRDI website, because and she'll be able to help you with anything related to submission. Again, nothing related to your ideas, but of course, anything related to submission or questions about the application. So back to the review, we have a 3-tiered process where 3 reviewers review your application. Then we have a group that reviews the application, which is a subgroup of the steering committee. And then those recommendations go to the full committee for approval. Of course, any applications that have any sort of variability comes to staff to look at, so that we make sure that we see that, you know, if you got 2 high scores and 1 bad score, that's not going to be thrown out. That's looked at and see why that variability exists, and it's brought to the committee for their attention. So like we mentioned, the award letters will come out on July 1st, and that we'll look at the program implementation beginning on August 1st. So as you can see at the end, we have our acknowledgements. We are so grateful to the Administration for Community Living for this incredibly generous grant to be able to impact so many communities nationwide. And I am really honored and excited to be part of this, and can't wait to see what you guys submit and what we end up doing over these 5 years. So with that, I'm going to turn it back over to Isabella, who is going to go through the next step.
Wonderful. Thanks, Sam. We are going to go ahead and move on to reviewing the budget template. So give me one moment, please.
Hey, can I just ask a question about the questions? Did you want to save questions till the end and talk about them for everyone, or the ones that are more personal, should I just go ahead and answer through the chat? What do you think, Lorna?
So I am currently answering the Q&As. So, but there are some that I do need some help on that we can speak to as a group.
I could jump in and answer some personally, and then if we want to elevate some, we could do that too. Okay.
Yep. Thank you.
Great. Thanks.
Thank you. All right. Going along to the budget template. So I want to start with saying that the budget template can be accessed via the link provided in the RFA in section 1.4.3. This template is really for drafting purposes only. The instruction would be to download a copy for you to use and to draft your budget accordingly. Your final budget will be manually inputted into the application platform, which I will show how to do a bit later. But I want to stress, if you are having any issues accessing this file, please do not hesitate to reach out to cdri@alz.org. We'll be able to download a version for you and send it over as an attachment. We do not want this to be a barrier. But again, this is really just for drafting purposes so that you feel confident going into your application for completion in the platform, and you'll just mirror and input your numbers accordingly. So looking at the budget template, there are a few things I want to call out. First, the fringe rate and the indirect rate, those are already set there for you. Please do not adjust them. Those are the standard rates as of now. Those have formulas attached to them and will actually be able to calculate accordingly for you. So example, if we had a personnel here in line 8 that we wanted to add, and perhaps their base salary is $50,000 and they're going to give 50% effort of their time, and that is something you're requesting funding for. You can see that once we input those numbers, even when you download this version, you'll see that the formula automatically goes ahead and calculates what that salary should be, what that requested fringe is, and what that total is going to be for the year. You'll also see that those numbers do correlate down to bottom and continue to show the formulas down here when you're looking at your total cost. So calculating your indirect costs to do your total cost. Anything that's in a blue box is for you to be able to input information. Anything else that's not a blue box, you really shouldn't have to put any information in. You shouldn't have to adjust anything. Again, we did try to make this as easy as possible, but we know that there could be some technical snags. So again, please don't hesitate to reach out with questions. There could be a few different line items that you might not need. So maybe you only need 1 or 2 personnel. That's okay, just leave them blank. If you run into a scenario where perhaps you need a few additional line items than we allocated, please reach out to me and I will make those adjustments for your application. Other than that, I think we can talk a little bit through the match component. So again, we understand that there is definitely some confusion around this, but I want to try to make it as simple as possible for you. So at first, you're going to do that calculation and you're going to say, no way is 25% of $100,000, for example, $33,000. You'd say that's $25,000. That's crazy. But that is the general formula, and I want to show how we get there. So the formula is actually calculating from the total requested grant funding with the match included. So when you take $100,000 and you times it by 0.25, which is that 25% requirement, and then you divide it by 0.75, you're going to get $333 as your match component, but then that makes the total overall budget, it's going to be $133,333. So again, that's taking that $100,000 that you're requesting of funding from us, from CDRI, then it's adding whatever your match component's going to be. So it does seem a little bit backwards, I understand, but hopefully that kind of helps to clear that up. If you need additional clarity or additional support, please don't hesitate to reach out. So that is the budget template in a nutshell. Again, if there are questions, we'll address those either in the Q&A or at the end. I would now like to go ahead and switch over to the application platform. Okay, so we are using an application platform called Submittable. We went with this platform, as Sam mentioned, just because it is a lot more user-friendly than other platforms we reviewed. We want this to not be a barrier for anyone. We want this to be as easy as possible for folks to take advantage of this opportunity. So in Submittable, you will be required to create an account, but the good news is that this actually allows you to start your application, save it, come back to it at a later date, so you can always come back and re-access. The application platform can be accessed on the center's webpage, alz.org/CDRI, or it is also linked in section 4.2.3 of the RFA. I do want to just mention the application platform here mirrors exactly all of the components that are outlined in the RFA. So there should be no surprises when you come into here to then complete your application and submit. So the first component of the platform is going to be just asking just general information, your organization name, the address, your EIN number, your contact. Now I do want to preface, whoever you put as this contact for the application, this does not need to be your program lead. This can just be whomever may be completing the application for your organization. We just need a good point of contact in case there are any questions or to share any updates throughout the process. So just asking for general information there. And then we have just a few general questions to understand a little bit more about your organization. Are you offering respite services currently? How do you describe your organization? Is it for-profit and nonprofit? Again, we do have that 30% maximum allocation for for-profit funding. We want to know a little bit about the type of setting that the proposed services will be provided in. I want to note here, I do not want anyone to get discouraged if perhaps their type of setting is not referenced here. These are some of the more common ones that we've seen in the past, but this is really about being innovative. We want to reach new audiences. We want to reach new communities. So please do not be discouraged if you're checking that other box. Again, another big part of this is really how do we hit some of the underserved populations. So we do want to know what your proposed program will target to try to reach some of these underserved populations or underrepresented communities. After that general information component, then we really lead into the meat of your application. So first, we're asking for your statement of purpose, and this is really understanding what is your organization's goal for participation. What are your local community needs that you know of in dementia-specific respite care? And then really just giving us a little bit more insight on your focus area of work and offerings and the importance of it. Now, each of these sections, I do want to state, has a word limit. So my suggestion for a tip, before you go into your application to actually submit it, maybe draft all of your responses to these question components in a Word document so that you can be tracking your word limits. So then you can easily just copy and paste into the platform when you're ready to submit. The next one, which is the biggest bulk of what we're asking for, is your proposed project. So we want to know, what is your detailed project description? How are you going to develop or improve the delivery of person-centered dementia-specific respite care? We want to know, how did you focus on innovation when you're discussing your program? Why or what you're proposing, is it innovative? We want to know what your program's responsiveness is to the unmet respite needs in your community. What is your focus on diverse, underrepresented, or underserved communities? And then again, want to define your project goals, your milestones, including a detailed timeline, which is actually part of an attachment that you can submit, which we will get to in just a few moments. And then another big piece of this is, how do you plan to be sustainable beyond the grant award period? We want to set these programs up for success and for longevity, so we want to be thinking about this on the onset. Moving to the next section, we're looking at your organizational capacity. So what is your organization's current respite service offerings if you have them? If you do not, that's okay. We are also, again, doing those startup awards. Describe, what is your current client reach? And this can be just what's your current reach in your organization, maybe if you're not already doing respite service offerings. And then talk a little bit about what your projected reach would be with the new program and your capacity to expand. Talk about any community partnerships, any collaborations that are really going to improve the success of your program. And then your ability to sustain, again, the efforts after the award period, and then your capacity to serve from a physical or an administrative lead standpoint. And then as Sam mentioned a little bit earlier, this lead staff member. So just sharing a little bit about who that staff member is, what their time allocation and their role will be, the rationale for selecting this individual, and then what is the detailed plan for leadership involvement and support. So then you get to the budget. So this should look very similar to the template that you were provided with. So you can see here, it has the fringe rate, it has the indirect rate. Now on this, in the template, it's any light blue box. On here, any white box is what you're going to be inputting your information for. So if it's a gray box or it has an X in it, you know that you won't have to fill it in. So I'll show here, you put that $50,000 as the base salary with 50% effort again, you'll see that the formulas automatically populate similar to exactly how your formulas worked in the template. So this should be mirroring exactly what the template provided. But again, I do not want this to be a barrier for anyone. So if you're having any technical difficulties or if you need those additional line items added, please reach out to cdri@alz.org. We ask for you to just highlight what the total funding requested is. This is to be your total funding requested, not with the match included. So if you're looking at requesting $100,000, please put $100,000, not $333 with the match portion, excuse me. Then you can just provide any additional rationale for your requested budget items. So that we did provide a few space to kind of speak to, what would the responsibilities for the personnel be, what are the item descriptions if you're looking to purchase equipment. But if there's anything that you feel we really need to know to justify what you were requesting, you can include it in this box here. This is optional. And then next we go into the different attachments. So we are asking for letters for commitment or support, your work plan with timeline and deliverables, the resume for the lead staff member, a W-9, and then a proof of licensure. This is only if it's applicable to your state and applicable to your type of care setting. So this might not be needed for all of our applicants, but if it is applicable to your organization, please upload that accordingly. So again, you can see here the save draft, submit. We hope that this is a very easy format for you to follow, that it's intuitive and user-friendly, but again, please don't hesitate to reach out with any questions. So at this time, I think, Lorna, we can address any questions in the Q&A that perhaps we weren't able to answer just in the platform.
Yeah, thanks. And thanks, everybody. We have a lot of questions coming in, and I know we're working behind the scenes to write responses to you. There are a few that I'm going to be reading out, and more blessings, Sam. I'll be asking for some thoughts on these. A couple questions.
Looks like a lot of them are for more blessing.
Yes. The match, the question we knew that would come up.
Yeah, Lorna, can I just interrupt with
yeah.
one real quick? Because
Please.
It seems like it's come up a few times in more blessing. Can you let me know this answer? I assume it's yes, but I don't know. Can people submit multiple applications, or is it just one application per organization? More blessing or Isabella, is it just one application per organization?
I think the way that we kind of structured it was that Any organization with its own EIN number can submit an application. Now, we had a question come through that a parent organization that has locations across the country would like to apply for funding, and then they would like to implement the program at all of their locations across the country. So that is an example of they would still only be submitting one application under the parent company's EIN number, and then they could disperse it accordingly. If there is an organization such as, I'll use AME Church for an example. They have multiple locations. If instead they wanted to individually submit applications based on their locations, they can, but we will only award 3 maximum to the same organization, even if they have different EIN numbers. Does that provide some clarity?
Yeah, thank you. So for us, like the Alzheimer's Association, let's say we applied for it, we could just apply once, right? Because all of our chapters are under one EIN. However, what we could do was apply for something through one application that impacts multiple locations, right? Okay. Because I think that, Lauren, I think that answers a few different questions in there with folks who had different types of services. So it would have to be through one application, or you'd have to want to impact multiple sites through that one application.
Yeah, another theme similar to that are questions around if the organizations fund respite. So they work with multiple private respite providers and they provide the funding. The way I've been responding, and if this isn't correct, then I'm just going to put it out there, that as it's written, we are looking for providers of respite, not funders of respite or coordinators that are coordinating other organizations. So I just want to clarify that.
Yeah, I think that's correct. Sam, would you agree?
I think the only way it would be different is that you could improve, if you could prove that what you're doing is creating a dementia capable service, that would have to be part of the larger umbrella. We're not just going to fund somebody to give out subsidies, right? Because that's not creating a dementia capable service. It's just giving folks money. So I think you need to think of the umbrella of what the services you're doing and how it's becoming dementia capable, and also the sustainability of it, right?
Yeah, thank you. I have a question. Is the 25% match applied to the indirect rate as well? More blessing.
Yes, that is correct. You can apply indirect cost on the match.
So I think this is the other way around. Is the 25% match applied to the indirect rate? So do they have to match the indirect rate also?
So when you're putting together your match requirements, say you have salary and benefits or volunteer hours, you're going to add the 10% match on top of those expenses to come up to the 25% match. So from Isabella's example, where you're trying to get to that 33,000, if you have costs up to, say, I'm trying to do the math, 20,000, and then you apply the 10% indirect cost, you can do that to get to the required match. I don't know if I'm answering the question correctly, Ilona, if it was asked either way, but yes, apply the 10% indirect cost on whatever match expenses you have on your budget.
Wonderful. What percent match can be in-kind volunteers? I think that was covered, but to clarify. Isabella, more blessing.
So match can be a combination of cash. It could be a combination of volunteer hours. So it doesn't have to be one or the other or exclusive. You can put several different items to get to that match. So I did see a question in the chat about whether or not I could use only volunteer hours to get to the match. If it does, and I believe we're going to provide a way of calculating volunteer hours, and that is what you're using as match, you can do that.
Great, thank you. We have a few people asking about an application rubric, looking at what parts of the application will be weighted in what way, and will they be shared a rubric?
So in the RFA, you can see the points that are allocated to each section. So they range from 10 points, 20 points, and to 30 points for a total of 100 points against what the application will be scored on.
Great, thank you. And there are some questions where I've been responding just to send us an email to the cdri@alz.org email box so that we can get some more specifics or answer a little more clearly for you. Just some general questions about, will the size of the program be a detriment to the grants? Looking at those underserved populations, are we talking about rural, or are we more focused on cultural communities? So Isabella, any thoughts on that?
I don't think we could say we're more focused on one or the other. I think that we're just trying to aim for reaching as many underserved and underrepresented populations and communities as possible.
Great. We have a couple questions around using additional funding. So this one, can funds be used to fill the gap between CMS paid guide funds and market wage rates?
Yes, so the funding that's coming through GUIDE is not directly correlated to this program. So you can go ahead and submit for an application regardless if you become a provider through the GUIDE program. The reimbursement is just not significant enough to really be using it towards this program, but I will allow Sam, or I see, Joe was able to join us. I don't know if anyone has additional thoughts on that component. No?
I don't. I would defer to Joe or more blessing.
I personally think if you are awarded, by the way, hi everyone, I apologize I joined late. So glad to see such robust participation, very exciting. I would say if you are indeed a guide participant beginning in July, that should not preclude you from pursuing these as well. Because if I recall correctly, one of the core elements of guide is indeed provision of respite, and utilizing these resources to maybe enhance or improve the delivery of respite within your guide program, I think is a great strategy personally. And I believe my colleagues agree here in the center. So.
Great. We have a few questions around letters of support. Are there particular partnerships that we're looking for in those letters of support? Financial letters of support from community? Can you give some more examples?
Sam, did you have anything in mind in terms of quantity of letters of commitment or support? I think that we kind of left it very open-ended for folks to just submit what they want to.
Yeah, I think it's really up to you. I think, if you think about what it is that you're proposing, think about who might be appropriate to support you. We're not looking for you to just give us 30 letters of support. Quantity isn't better than quality. So I would just say, think of who's most important for your application. If you think, that might be somebody you're partnering with, that might be somebody who helps show the need for it, whatever you think is going to make your application stronger. But again, it's quality, not quantity. So just think about who would be most appropriate for your award.
Isabella, I think you touched on this, but a lot of questions about the volunteer hour rate that could be used. More blessing, you're nodding. You want to take this one?
I do. There are questions coming in to say what rate do we need to use in order to calculate the match. I know there's a national volunteer rate of $31.80 an hour, and somebody posted that on the website. We will provide additional clarity on the website in terms of what hourly rate to use, because we want consistency across all our applicants on the hourly rate to use. So more to come.
Great, thank you. We have a question. If an organization currently has an ACL ADPI grant, does that disqualify them from participating?
Sarah, do you know that anything about that you might be able to address?
I don't know specifically on that grant. I do know that if you have similar funding sources, you can't override or supplant federal grant funds. So you would need to be very careful on if you are funding one project in one way, you can't supplant or duplicate with another funding source. So I'm sure that that would need to be a conversation if somebody has another funding source that is helping cover respite in this way.
Great. And we will put a lot of these questions together in an FAQ and have it posted to the CDRI webpage. So if you don't get your answer right now, we'll be working on some of these to post, or if you need immediate response, again, to send us an email to the cdri@alz.org email box. There was a few questions around people who already have pilot projects in place, or they've already started some work. Could we reimburse them for work done previous to the start of this grant? And I believe I had said no, and More Blessing is confirming. More Blessing, did you want to just say anything specific to that?
No, so you would want to wait until you are given an award before you can request reimbursement. So I would caution on you starting to do any work in anticipation of this award. The other thing to keep in mind is that there are start and end dates to a contract. So you want to make sure that any expenses that you incur are within the contract period. So if you start work, say in June, and you are getting an award in August, we will not be able to reimburse your June through August expenses because it's going to be from when you get the contract.
Great, thank you. I think a lot of these we've gone through. Are there audit requirements for applying organizations?
If you are an organization that does get audited and you meet that threshold of $750,000 of federal awards, we are going to be asking for your most recent audited financial statements.
Thank you. Can you provide some clarity on funding limitations, specifically administration, that's referred to in section 2.32 and 2.22? So Isabella, I'll give you a minute to get to that page.
Yes, I actually would like to call on More Blessing if she would be willing to provide a little bit more insight on those limitations.
Absolutely. So for the most part, administrative costs are covered with indirect costs, unless you're providing an extenuating circumstances where you do need a lot of the administrative help to administer the work. So you would need to provide it in your budget justification. But generally, administrative cost, occupancy would be considered as part of the indirect cost and not directly related as direct cost to the project. So we would need more justification of why you're putting in administrative cost as a direct line item on your budget.
Hey, Lorna, since we have More Blessing, I'm just going to jump in here too. Could you please explain the SAMS requirement for those who are not familiar with what that means? And that doesn't go to me at all, just so you know. So it's not my requirement, it's something else.
So organizations that do business with the federal government or you're receiving federal funds, you need to be registered in sam.gov. I believe there are instructions of how to do that. It's really a simple process of, if you are an organization, just go in and register so you have your unique identifier number set up. We will not be able to issue you an award if you're not registered in SAM. Please reach out to us through our website for additional assistance and help in getting that set up.
Great. Sam, any others in there that are pressing? There was a few around how long do our pilot awardees get? How much time do they get before they get like up and running if they're starting a new program?
Yeah, I answered a few of those, Lorna. I mean, the goal is that it's a year-long grant. So whatever you propose, you have to accomplish within that year. So it's you can't have the first year to plan and then reapply for the second year. It's to accomplish something within that year. So you're going to have to build your timeline to show that you know, you're going to be able to hit the ground running at some point so that you could finish it by the end of the year.
Great. If you're not successful in year one, will you provide feedback from the review teams?
Yeah, we need to talk through that, but I think that if people reapply for a second year and you don't get it, we could definitely figure out how to provide some feedback back.
Great. We got a few minutes left. Did I hear correctly that ideas on software tools for respite care is not eligible unless we provide the respite itself?
Can you say that again?
Mm-hmm. Did I hear correctly that ideas on building software tools for respite care is not eligible unless we provide the respite itself? So I think there's a lot of questions around people who provide things for respite providers but aren't supplying the respite. And I know in our support with our technical assistant, we are working with the organization, I believe, providing the respite. But I defer to you, Sam or Isabella.
No, I think developing a solution is not appropriate for this type of grant award. It's really for people who provide the respite. So a solution could be integrated into the person who's providing so somebody could be using a solution and that would be how they're making their service more dementia capable, but it can't be just about developing a solution.
And then that provider could be the applicant.
Correct.
Following. Okay. I think that answers a lot of the questions that are out there right now for people who don't provide the respite. That's great. Still a lot about the volunteer hours, and we'll put some more in our FAQs for that and some links if we need.
Yeah, there's another question, Lorna, and Joe, maybe you might want to chime in here, but people are asking a little bit about outcomes and outputs and what's more important, quantity or quality? You know, so is it more how many people they serve or how innovative their program is? And I don't know if you want to say anything about that, but you know, my thought is that I think that we're looking for innovation, we're looking for reach too, but I think it's really up to you about how you're going to describe your program and what you're going to build. But I thought you might have some thoughts, Joe.
Yeah, I mean, real briefly, I don't think we have a lot of time to get into the full evaluation of this, but, certainly reach and numbers is important, but, alongside that is documenting that this program is having some degree of benefit on people living with dementia, staff, and potentially family members as well. There's a lot of ways to do that depending on the size of your program, and how you'll collect that information, but that first and foremost within your program is what you want to be thinking about when doing evaluation. And remember, we also are contracting with a evaluator that will be working across all the funded projects to kind of identify pieces of information that will be collected systematically across all the programs that'll give us further insights as to how well this is working. I think the idea of reach and as such, that depends so widely. The question came up earlier about is rural underserved? I would argue absolutely it is, and I believe it is under ACL guidelines. Certainly we encourage applicants from those regions with an understanding that your reach might be very, very different if you're a bricks and mortar program than say one that has a much larger footprint in a given area. And I think for our purposes, again, as Sam had mentioned, we are looking to fund innovation and dementia respite. Your program may be small, it may be large, it may be operated out of traditional or non-traditional contexts. I think our goal is to identify those efforts that are innovative, and we'll try to do our best to support them.
Thanks, Joe. And Lorna, I know we only have a couple minutes left, and I mean, we didn't get to answer everybody's questions, so I think that we'll try to do that afterwards. But if you don't hear from us, please send your question to the mailbox. There was one other thing that I wanted to just touch on. Oh, I know what it was. Joe, people don't need to build in their own evaluations into any of their projects, right? Because we'll be doing evaluation across. So they shouldn't really waste time talking about evaluation.
I think so. Yeah, I agree. I would not. I mean,
Okay.
I think this is about you showing us what are you doing that's innovative, what is the need for dementia respite vis-a-vis your given program. And again, how are you doing something that's new and unique that could not only benefit the people within your program, but can serve as a model to other programs? I mean, if I was writing this, and again, this is me, granted, I'm a researcher, so take that with a grain of salt. Maybe you want to just cut this part off of the webinar. But that being said, I mean, if I was having to write this, that's what I would be focusing on. What are you doing that's innovative? Who are you serving that's innovative? And what are you doing to really kind of push the envelope in terms of how we provide respite for people living with dementia and their families or other individuals?
Thanks, Joe. Well, I know Lauren and I have been working hard to get these Q&As down to below 30, but it keeps popping above 30. So we can't keep it down. So we'll do our best to answer after the call. Isabella, I'm going to turn it over to you for the last words.
Yep. Thank you all so much for your participation and your thoughtful questions. Again, please don't hesitate to reach out to cdri@alz.org for any additional support and technical assistance. The webinar is being recorded and will be uploaded to the center's webpage as soon as possible for viewing. Thank you, and because of you, we're able to enhance and grow respite services to bring relief to more caregivers nationwide, so we are so excited. Have a wonderful rest of your day.
Thank you, everybody. Good
Thank
luck.
you.